What if I told you that 5 simple changes to your bathroom routine could protect you from stroke, heart disease, and infections that kill thousands of seniors every year? In the next 15 minutes, I'll reveal 5 scientifically proven bathroom habits that can dramatically improve your health and potentially add decades to your life. Habits so simple you can start using them today. Habit number 5 takes just 30 seconds, but could be the difference between catching a life-threatening problem early or discovering it too late to treat. Dr. Amanda Williams, a geriatrician at Johns Hopkins, noticed that her healthiest patients over 90 all shared similar bathroom habits that most people never think about. When she studied these patterns, she discovered that simple bathroom routines were protecting these seniors from infections, cardiovascular events, and digestive problems that hospitalize thousands of Americans every day. The habits cost nothing and take less than 5 minutes total per day. Habit 1. Using proper toilet posture. The way you sit on the toilet could be the difference between healthy elimination and dangerous straining that damages your heart and blood vessels every single day. Mayo Clinic research on toilet posture and cardiovascular health shows that the standard Western toilet position forces your body into an unnatural angle that requires excessive straining to complete bowel movements, dramatically increasing blood pressure and putting dangerous stress on your cardiovascular system. When you sit on a regular toilet with your knees at hip level, your puborectalis muscle doesn't fully relax, creating a kink in your rectum that makes elimination difficult and forces you to strain against your body's natural design. This straining triggers the Valsalva maneuver, which can cause blood pressure spikes of 40 points or more, putting seniors at immediate risk for heart attacks, strokes, and dangerous heart rhythm irregularities. For seniors whose cardiovascular systems are already under stress from aging, this daily straining can be the trigger that causes a life-threatening medical emergency. The human body evolved to eliminate waste in a squatting position where the thighs are elevated above the hips and the puborectalis muscle fully relaxes to allow easy, complete elimination without straining. Harvard Medical School research demonstrates that proper toilet posture reduces the pressure required for bowel movements by up to 75%, dramatically decreasing cardiovascular stress and reducing the risk of hemorrhoids, anal fissures, and pelvic floor dysfunction. When your feet are elevated 6 to 9 inches while sitting on the toilet, your body assumes a position closer to the natural squatting posture, allowing gravity to assist elimination and reducing the need for dangerous abdominal straining. This simple postural change also helps ensure more complete elimination, reducing the risk of constipation and the associated problems like impacted stool, diverticulitis, and colon cancer that disproportionately affect seniors. Proper toilet posture also benefits your pelvic floor muscles, which support your bladder, uterus, and rectum and naturally weaken with age, particularly in women who have given birth. The American College of Gastroenterology has documented that seniors who use proper toilet posture have significantly lower rates of pelvic organ prolapse, urinary incontinence, and chronic constipation compared to those who use standard sitting positions. The elevated foot position also reduces pressure on the anal sphincter and surrounding blood vessels, preventing the development of hemorrhoids that affect over 75% of people over age 50. This natural positioning allows your intestinal muscles to work efficiently without the excessive effort that causes hernias, varicose veins, and other complications associated with chronic straining. The solution requires no prescription, no doctor visits, and costs less than $20 for a lifetime of protection. Purchase a toilet stool that elevates your feet 6 to 9 inches while seated, or use a sturdy box or step stool that positions your knees slightly above your hips. Many bathroom supply stores sell specially designed toilet stools that fit neatly around the base of your toilet when not in use. The key is finding the right height for your body. Your thighs should be elevated above your hips with your feet firmly planted on the elevated surface. Thomas from Oregon suffered from chronic constipation and high blood pressure until he started using a toilet stool at age 74. Within 3 weeks, his bowel movements became regular and effortless. His blood pressure readings during bathroom visits dropped significantly, and he no longer experienced the dizziness and heart palpitations that used to follow his bathroom routine. Change your toilet posture starting today and protect your heart from the dangerous strain that sends thousands of seniors to the emergency room every year. Habit 2. Never rushing or straining. During bowel movements, rushing your bathroom routine could literally stop your heart, and the pressure you create when forcing bowel movements can trigger the same cardiovascular events that kill people during snow shoveling or heavy lifting. American Heart Association warnings about bathroom straining indicate that the sudden increase in abdominal pressure and blood pressure during forced bowel movements can cause immediate heart attacks, strokes, and dangerous arrhythmias, particularly in seniors whose cardiovascular systems are already compromised by age-related changes. The Valsalva maneuver that occurs during straining temporarily stops blood flow back to the heart, causing a dramatic drop in cardiac output, followed by a dangerous rebound spike in blood pressure when the strain is released. This cardiovascular roller coaster can rupture weakened blood vessels in the brain, trigger irregular heartbeats, or cause blood clots that lead to heart attacks or strokes. For seniors taking blood pressure medications, blood thinners, these pressure changes can be particularly dangerous and unpredictable. The biological process of elimination is designed to happen naturally and effortlessly when you're ready. But modern lifestyle factors, stress, poor diet, dehydration, and lack of physical activity often interfere with this natural rhythm. Johns Hopkins gastroenterologists have documented that people who allow adequate time for natural bowel movements without forcing or rushing have significantly lower rates of cardiovascular events, hemorrhoids, anal fissures, and pelvic floor dysfunction compared to those who strain regularly. The simple act of relaxing and breathing normally during bowel movements keeps your blood pressure stable, maintains healthy blood flow to your heart and brain, and prevents the dangerous pressure spikes that can cause immediate medical emergencies. This patient approach also allows your intestinal muscles to work at their own pace, ensuring more complete elimination and reducing the likelihood of constipation that leads to more straining in the future. Many seniors develop the dangerous habit of rushing their bathroom routine due to mobility issues, fear of falling, or simply wanting to minimize time spent in the bathroom. But this hurried approach significantly increases health risks. The Mayo Clinic recommends that seniors allow themselves time for bathroom visits, bring reading material, or use breathing exercises. Stay relaxed and never attempt to force bowel movements when their body isn't ready. Creating a calm, patient bathroom environment reduces stress hormones that can interfere with normal digestive function and helps maintain the relaxed state necessary for healthy elimination. This approach also prevents the anxiety and tension that can create a vicious cycle of constipation and straining. The key to safe bathroom habits is understanding that your digestive system operates on its own schedule and cannot be safely rushed or forced without creating dangerous health consequences. When you feel the natural urge for a bowel movement, respond promptly, but never attempt to create an urge through straining or forcing. If a bowel movement doesn't happen easily within a few minutes, simply try again later when your body signals readiness. This patient approach prevents the cardiovascular stress that can trigger medical emergencies while promoting healthy digestive function. Maria from Texas was having several small heart episodes that her doctor couldn't explain until they discovered she was straining excessively during bowel movements due to chronic constipation. When Maria learned to relax, breathe normally, and never force her bowel, heart episodes stopped completely and her constipation improved dramatically within just 2 weeks. Take your time in the bathroom, breathe normally throughout the process, never strain or force anything, and allow your body's natural rhythms to work safely and effectively. Protect your heart by slowing down and respecting your body's natural processes, starting with your very next bathroom visit. Habit 3. Washing hands for full 20 seconds every time. This 20-second habit prevents the infections that kill more seniors than cancer, heart disease, or diabetes. Yet most people perform it incorrectly or skip it entirely. CDC guidelines on hand hygiene and infection prevention show that proper hand washing after bathroom use eliminates 99% of harmful bacteria, viruses, and parasites that cause life-threatening infections in seniors, whose immune systems are naturally weakened by age and often compromised by chronic conditions or medical treatments. The bathroom environment contains dangerous pathogens like E. coli, Salmonella, Clostridium difficile, and norovirus that can cause severe digestive infections, bloodstream infections, pneumonia, and sepsis that are frequently fatal in people over 65. These microscopic organisms can survive on bathroom surfaces for hours or days, and inadequate hand washing allows them to spread to everything you touch, including food, eating utensils, and your face, creating multiple opportunities for serious infections. For seniors living in assisted care facilities or those with compromised immune systems, proper hand washing is literally the difference between staying healthy and developing life-threatening infections. The standard quick rinse that most people perform after using the bathroom removes only surface dirt and debris, while leaving behind the dangerous microorganisms that cause serious infections. Harvard Medical School. Infectious disease research demonstrates that effective hand washing requires a full 20 seconds of vigorous scrubbing with soap and warm water to physically remove and kill the pathogens that can cause illness. The mechanical action of rubbing your hands together creates friction that loosens bacteria and viruses from your skin, while soap molecules surround and destroy the protective membranes of harmful microorganisms. Without adequate time and proper technique, hand washing provides a false sense of security while leaving you vulnerable to the same infections that send thousands of seniors to the hospital every year. This is particularly important for seniors who may be taking antibiotics, steroids, or other medications that suppress immune function and make infections more likely and more severe. Proper hand washing technique involves wetting your hands with clean water, applying enough soap to cover all surfaces, rubbing hands together vigorously for at least 20 seconds while scrubbing all surfaces including palms, backs of hands, between fingers and under fingernails, rinsing thoroughly with clean water and drying with a clean towel or air dryer. The 20-second time frame can be measured by singing "Happy Birthday" twice or counting slowly to 20, ensuring adequate contact time for soap to kill harmful organisms. Pay special attention to fingertips and under fingernails, where bacteria and viruses commonly hide and multiply. If soap and water aren't available, use an alcohol-based hand sanitizer with at least 60% alcohol content. But remember that sanitizers don't remove dirt and are less effective against certain types of germs than proper hand washing with soap and water. The investment of 20 seconds of your time can prevent infections that could cost you weeks in the hospital, thousands of dollars in medical bills, and potentially your life. Seniors who practice proper hand washing consistently have dramatically lower rates of respiratory infections, digestive illnesses, skin infections, and urinary tract infections compared to those with poor hand hygiene habits. This simple practice is particularly crucial before eating, after using the bathroom, after coughing or sneezing, and after touching surfaces in public places where harmful microorganisms are commonly present. Barbara from Florida used to get respiratory and digestive infections several times per year until she learned proper hand-washing technique from her infection control nurse. After implementing the full 20-second hand-washing routine consistently, Barbara went 2 full years without a single infection and avoided the hospitalizations that had become routine parts of her life. Wash your hands with soap and warm water for a full 20 seconds every single time you use the bathroom, and make this life-saving habit as automatic as flushing the toilet. Perfect your hand-washing technique today and protect yourself from the preventable infections that threaten senior health every day. Habit 4. Following a regular bathroom schedule. Holding it when nature calls could be slowly poisoning your body with toxins that should be eliminated immediately, while creating conditions for dangerous infections and organ damage. Harvard Medical School research on bladder and bowel health shows that regularly delaying urination or bowel movements when you feel the natural urge can lead to urinary tract infections, kidney stones, bladder dysfunction, chronic constipation, and potentially life-threatening complications like kidney infections or bowel obstructions. When you ignore your body's signals to eliminate waste, urine remains in your bladder where bacteria can multiply rapidly, creating infections that can spread to your kidneys and bloodstream. Similarly, delaying bowel movements allows stool to become hard and dry in your colon, making elimination more difficult and potentially leading to impacted stool, hemorrhoids, anal fissures, and increased absorption of toxins that should be leaving your body. For seniors, whose kidney and digestive function naturally decline with age, these delays can cause serious complications that require medical intervention and hospitalization. Your body's elimination signals are precisely timed biological processes designed to remove waste products at the optimal moment for your health and safety. The American Urological Association has documented that people who consistently respond promptly to natural urges have healthier bladder function, lower rates of urinary tract infections, and better overall kidney health compared to those who routinely delay bathroom visits for convenience or social reasons. When you feel the urge to urinate, your bladder has reached the ideal capacity for efficient emptying, and delaying this process forces your bladder muscles to work harder while creating stagnant conditions where harmful bacteria can flourish. The same principle applies to bowel movements. When your body signals readiness, your intestinal muscles are coordinated to move waste efficiently through your system, and delaying this natural process disrupts the rhythm and can lead to chronic constipation and related complications. Many seniors develop patterns of delaying bathroom visits due to mobility challenges, fear of public restrooms, or simple inconvenience. But these delays create cumulative health risks that can become serious over time. The Mayo Clinic recommends that seniors prioritize responding to natural elimination urges immediately, even if it means interrupting other activities or planning schedules around bathroom needs. This approach prevents the health complications associated with holding waste in your body longer than necessary, while maintaining healthy patterns of elimination that support overall health. Planning your daily schedule to include regular bathroom breaks, particularly after meals, when digestive activity naturally increases, can help prevent the situations where you're tempted to delay elimination for convenience. Creating and maintaining a regular bathroom schedule also helps train your body's natural rhythms and can prevent some of the elimination problems that commonly affect seniors. Many gastroenterologists recommend establishing consistent times for bathroom visits, particularly first thing in the morning and after each meal, to support healthy digestive function and prevent constipation. This proactive approach works with your body's natural circadian rhythms and can help maintain regular elimination patterns even as digestive function changes with age. Kenneth from Arizona suffered from chronic urinary tract infections and kidney stones until he learned to respond immediately to every urge to urinate, regardless of what he was doing or where he was. Within 6 months of never delaying bathroom visits, Kenneth's infections stopped completely. His kidney function improved, and he no longer experienced the burning and urgency that had plagued him for years. Use the bathroom immediately when you feel any urge to urinate or have a bowel movement, and never delay elimination for convenience, social reasons, or any other factor. Listen to your body's signals starting now and protect your kidneys, bladder, and digestive system from the damage caused by holding waste longer than necessary. Habit 5. The 30-second health check routine. This 30-second bathroom routine has helped seniors catch life-threatening problems months or even years before doctors would find them through routine testing, potentially saving thousands of lives through early detection and treatment. American Cancer Society recommendations for self-monitoring emphasize that changes in urine and stool appearance, frequency, or characteristics can be the earliest warning signs of serious diseases like colon cancer, bladder cancer, kidney disease, liver problems, and digestive disorders that are much more treatable when caught early. The simple act of observing your elimination patterns and noting any changes provides invaluable health information that can alert you to problems long before symptoms become severe enough to seek medical attention. For seniors who have higher risks of developing these serious conditions, this daily health monitoring can literally be the difference between catching a treatable early-stage disease and discovering an advanced condition with limited treatment options. This practice costs nothing, requires no special equipment or training, and takes less time than brushing your teeth. Most people never look at their urine or stool, missing obvious warning signs of serious health problems that could be addressed effectively with early intervention. Johns Hopkins oncologists have documented cases where patients who practiced daily bathroom health checks discovered colon cancer, bladder cancer, and kidney disease months before these conditions would have been detected through routine medical testing. Changes in urine color, clarity, odor, or frequency can indicate everything from dehydration and urinary tract infections to kidney stones, diabetes, liver disease, and kidney failure. Similarly, changes in stool color, consistency, frequency, or the presence of blood can signal conditions ranging from simple dietary intolerances to inflammatory bowel disease, colon polyps, and colorectal cancer. These visual clues are your body's early warning system, alerting you to problems while they're still in treatable stages. The health check routine involves spending 30 seconds observing your urine and stool each time you use the bathroom, noting the color, consistency, frequency, and any unusual characteristics like blood, mucus, or changes in odor. Normal urine should be pale yellow to amber in color, clear rather than cloudy, and have little to no odor. Dark urine can indicate dehydration, liver problems, or kidney disease, while cloudy urine often suggests infection. Blood in urine, even small amounts, can indicate bladder infections, kidney stones, or more serious conditions like bladder or kidney cancer. Normal stool should be brown in color, formed but not hard, and should pass easily without straining. Black, tarry stools can indicate bleeding in the upper digestive tract, while bright red blood suggests lower digestive tract problems. Pale or clay-colored stools can indicate liver or gallbladder problems, while persistent changes in consistency or frequency warrant medical evaluation. The key to effective health monitoring is establishing what's normal for your body and then noting any changes from your personal baseline. Keep a simple bathroom diary or mental note of any unusual changes and report persistent changes to your healthcare provider promptly. Don't ignore warning signs or assume that changes are normal parts of aging. Many serious conditions are highly treatable when caught early, but become life-threatening when allowed to progress undetected. This daily health check empowers you to be an active participant in your healthcare and can provide your doctor with valuable information for diagnosis and treatment planning. Brenda from Michigan discovered blood in her stool during her daily health check routine and immediately contacted her doctor, leading to the diagnosis of early-stage colon cancer that was completely curable with surgery. Her doctor told her that without this early detection, the cancer would likely have progressed to an advanced stage before causing symptoms, dramatically reducing her treatment options and survival chances. Spend 30 seconds during each bathroom visit observing and noting any changes in your urine or stool, and report any persistent changes to your healthcare provider immediately. Start your 30-second health check routine tomorrow morning and take control of your health through this simple but potentially life-saving practice. These 5 bathroom habits can dramatically improve your health and potentially add decades to your life by protecting you from infections, cardiovascular events, and serious diseases, while helping you catch problems early when they're most treatable. The simple changes to use proper posture, avoid straining, wash hands thoroughly, respond to natural urges immediately, and perform daily health checks take less than 5 minutes total per day, but provide protection worth thousands of dollars in medical costs and potentially years of healthy life. Your bathroom routine is completely under your control, and these evidence-based practices can improve your health starting immediately, regardless of your current age or medical conditions. Which of these 5 bathroom habits were you doing wrong, and which one are you going to change first? Share in the comments which habit surprised you the most, because your honesty might help another senior avoid a serious health problem. And if you know someone over 60 who could benefit from these life-protecting bathroom habits, share this video with them immediately, because these simple changes could literally save their life. And subscribe for more health secrets that keep seniors safe and healthy at home.